agree that it was a very contentious hearing. I think the thing that is very clear and very concerning for those of us who care about public health and the health of the American public is that we have essentially an HHS secretary who is decimating their own agency. What we know beyond the confusion that is being sown about vaccines is that thousands of CDC employees, even if we just stick with the Centers for Disease Control for a moment, thousands of people have been fired. We now do not have a director who is qualified at the head of the CDC, and we've had several high-level resignations of key scientists and leaders. So that is something that has certainly happened and was not resolved by today's hearing.
Doctor, can you just explore the hypothetical for me here? In the case of another pandemic or another wave or another variation of the COVID infection, what is the actual policy here? As you suggest, with the scientists, with the heads of these departments gone, what actually happens operationally to deal with a situation like that?
Yeah, well, you didn't have me here to terrify people, and I don't want to speculate too much on what another pandemic could look like. Obviously, that would be an extreme situation. And frankly, in terms of COVID, we got lucky because, in fact, the mortality rate was relatively low. If we did get hit with a disease that had a higher mortality rate, we know we lost millions of lives in the United States. It could be worse. But let's stick with what's happening right now, which is frankly bad enough, which is that we are losing in many communities what we used to call herd immunity, but we try to call community immunity for things like the measles. So we've had more than 2 times the number of measles outbreaks this year as we had even just a year ago. And 1 in 5 kids under the age of 5 who got the measles ended up in the hospital. So that is something that's happening right now without any further changes in policy. So I think we have to be very worried about a committee of now wildly unqualified people changing the vaccination schedule even more.
I want to ask you about Susan Monterez, who, of course, was at the head of the CDC and was fired by RFK Jr. There was a conversation in this hearing today about why. And I first want to mention the fact that ahead of this hearing, Monterez wrote an op-ed in the Wall Street Journal. Those seeking to undermine vaccines, she writes, use a familiar playbook, discredit research, weaken advisory committees, and use manipulated outcomes to unravel protections that generations of families have relied on to keep deadly diseases at bay. Once trusted experts are removed and advisory bodies are stacked, she writes, the results are predetermined. That is not reform, it is sabotage. RFK Jr. today talked about the need to fire Susan Monterez because she lied to Americans when she said she was fired for refusing to adopt or endorse vaccine recommendations that were not supported by science. Did she deserve to be fired?
Of course not. And what's ironic here is that for the first time in our history, the director of the CDC actually went through a Senate confirmation. And many people were skeptical about Dr. Monterez and whether she would just rubber stamp some of these unscientific changes to particularly vaccination policy. When she would not do that, RFK tried to fire her. He's not actually authorized to do that, and the White House followed up. You have multiple high-level career scientists who are saying the exact same thing. There's absolutely no reason to doubt Dr. Monterez's explanation, and I think that she is pointing toward exactly what has happened here. Secretary Kennedy has started an organization and has been a vaccine skeptic and underminer for a long time now. And he now has a much larger bully pulpit and in fact is overseeing, ironically, the organizations that make vaccine policy for this country. I think, like most of my public health and healthcare colleagues, 20 leading organizations today asked for him to step down, including the American Public Health Association, and I am certainly in agreement with that being what would be most appropriate given the actions of the last couple of weeks.
Mm-hmm.
Dr. Kantor, we've seen that skepticism manifest most realistically and in real time when it comes to the COVID vaccines. But can you just walk us through the other places of the healthcare policy that is in the United States right now where you are starting to see that show up?
Sure. I mean, I mentioned one already, which is in the measles outbreaks and the worries that people have about the measles, mumps, and rubella vaccine. I think COVID is a very important place that we know that many people do remain vulnerable, including people like healthy pregnant women. And the American Academy of Pediatrics actually has now broken with the new guidelines from the federal government and said that children up to age 2 absolutely need to be vaccinated. So that is another place. And I think more and more we are hearing about parents who've heard a lot of this rhetoric opting their children out of certain vaccines. I think the most concerning public policy development was out of Florida yesterday when they announced that for any vaccines over which the Florida Health Commissioner has jurisdiction, which is not all of them, they will no longer be required for schools. So I just want to remind people that vaccines are not just about individual immunity. We need a large proportion of people to get them, or else a disease can take hold in a community.
Mm-hmm. But Dr. Kantor, if I went to a CVS or a Walgreens across the street, would I be able to get a vaccine if I asked for it?
Depends what state you're in. So, for example, I'm coming to you from New Jersey, where I'm very proud to say that many pharmacies are continuing to make COVID vaccines available to anybody who is eligible and without a prescription. In some states, they are requiring people to have a doctor prescription. Some states are working to make sure that their head of the State Department of Health can act as that sign-off doctor. But then there are sets of states where pharmacies believe that they're going to have trouble getting reimbursements, and they've announced that they are not going to make COVID vaccines as available. So this is becoming not just 2 Americas, but potentially 50 Americas, where your access to the vaccine may depend on your own state and their ability to develop workarounds.